PHTLS Practice Test Tips 2026 Prehospital Trauma Life Support All You Need to Know Exam. Question 1. In the PHTLS assessment, what does the X stand for in XABCDE? X-ray, extra care, exsanguinating hemorrhage, exertion. Massive, life-threatening external bleeding is addressed first. Question 2. What is the first step in managing a patient with massive external bleeding from an extremity? Apply oxygen, apply direct pressure or a tourniquet, check the pulse, immobilize the neck. Immediate control of life-threatening bleeding is the priority. Question 3. Which finding is part of Cushing's triad in head trauma? Low BP, fast pulse, high systolic BP, slow pulse, irregular respirations, nausea, vomiting, diarrhea, tachycardia, tachypnea, hypotension. Cushing's triad indicates rising intracranial pressure, ICP. Question 4. When should a motorcycle helmet be removed from a trauma patient? Always remove it immediately. If it interferes with airway management or is loose, only if it is cracked. Never remove it in the field. Keep it on if it fits well and doesn't hinder the airway. Remove it to manage the airway. Question 5. Which type of skull fracture often presents with Battle's sign or raccoon eyes? Linear, depressed, basilar, compound. Basilar skull fractures involve the base of the skull. Question 6. What is the golden period in trauma care? The first 5 minutes. The time from injury to definitive surgical care. The hour after the ambulance arrives. The time spent on scene. The goal is to get the patient to surgery as quickly as possible. Question 7. A patient with a flail chest will exhibit what type of chest wall movement? Normal, paradoxical, inward on inspiration, outward on expiration, symmetric, rapid. Flail chest occurs when 2 or more ribs are broken in 2 or more places. Question 8. Which intervention is definitive for a tension pneumothorax in the pre-hospital setting? Oxygen, needle decompression, chest tube, intubation. Needle thoracostomy, decompression, relieves the pressure. Question 9. According to the rule of nines, what percentage is the entire right arm of an adult? 4.5%, 9%, 18%, 1%. Each arm is 9% in an adult. Question 10. The Glasgow Coma Scale, GCS, measures which 3 categories? Pulse, BP, respirations, eyes, verbal, motor, skin, pupils, strength, mental, physical, social. GCS evaluates eye opening, verbal response, and motor response. Question 11. What is the most common cause of shock in the trauma patient? Anaphylaxis, hypovolemia, hemorrhage, cardiogenic, neurogenic. Hemorrhagic shock is the primary concern in trauma. Question 12. A pelvic binder is used primarily to relieve pain, reduce pelvic volume and control internal bleeding, hold the patient's pants up, prevent leg movement. Binders stabilize open book pelvic fractures and tamponade bleeding. Question 13. In spinal motion restriction, what is the neutral position for the head? Chin to chest, looking straight ahead, head tilted back, head turned to the side. The head should be aligned with the spine in a natural position. Question 14. What is the primary concern with a patient who has stridor and facial burns? Pain, airway obstruction due to swelling, infection, hypothermia. Stridor indicates upper airway narrowing/swelling. Question 15. Secondary blast injuries are caused by the pressure wave, flying debris and shrapnel, Being thrown against an object. Burns and toxic fumes. Primary is the wave, secondary is debris, tertiary is displacement. Question 16. Which medication is increasingly used in the field to help control internal bleeding? Aspirin, tranexamic acid, TXA, morphine, heparin. TXA helps prevent the breakdown of blood clots. Question 17. A patient has an open chest wound. How should it be dressed initially? With a porous gauze. With an occlusive dressing taped on 3 sides. Left open to air. Tightly wrapped with elastic bandage. A 3-sided occlusive dressing acts as a one-way valve. Question 18. What is the lowest possible score on the GCS? 0, 1, 3, 5. Even an unresponsive patient gets 1 point in each category, total 3. Question 19. What does the E in ABCDE stand for? Energy, environment/exposure, electricity, emergency. Expose the patient to find injuries, then protect from the environment, hypothermia. Question 20. Distributive shock caused by spinal cord injury is specifically called hypovolemic, septic, neurogenic, anaphylactic. Neurogenic shock involves loss of sympathetic tone below the injury.